Good evening again, everyone. I'm Keisha Adderley. Welcome to the Bahamas Tonight, the National Report. Topping news this evening, the second wave of COVID-19 has shown significant increases throughout the country. Health officials today outlined how the virus has spread in specific demographic groups. Our Altaviz Munnings joins me live in studio tonight. Altaviz, the Ministry of Health wrapped up that press conference about half an hour ago. What do they have to say?
Well, good evening, Keishla, and good evening, Bahamas. Ministry of Health officials say that the second wave of the COVID-19 pandemic has definitely shown an increase in the cases across the country. They say that that trends for COVID-19 is an important indicator of tracking COVID-19 cases across the Bahamas. Now, at that press conference this afternoon, health officials say they've diagnosed 27 times the COVID-19 cases during the second COVID-19 wave compared to the first.
For New Providence, which has the highest population density, we had 76 cases in the first wave. At this point in the second wave, COVID-19 cases now stand at 1,797, which is almost 24 times more than their total cases seen in the first wave. Grand Bahama recorded a total of 8 cases in the first wave. So far, for this wave, our second city has a total of 603 cases, which is 75 times more than their total cases in the first wave.
Now, New Providence accounts for the largest amount of COVID-19 cases each day, and over the past week, new cases have been on a decline on the island, all because of an average of 40 new cases that are reported each day. Contact tracing efforts by health surveillance unit officials continues, with almost 8,000 connections being made in the second wave. Now, health officials attribute a subsequent flattening of the COVID-19 curve in Grand Bahama to the lockdowns implemented in the summer. Abaco's curve leveled off, although health officials acknowledge a modest uptick in new cases there over the past 72 hours. Now, Bimini's COVID-19 picture is encouraging to health officials, as there is a clear flattening of the curve on that island. Health officials also announced today that they continue to categorize COVID-19 cases by age group and gender.
What we find, though, is that there is a concentration of about 41% of COVID-19 cases among persons ages 20 to 39. Another 37% of our cases are for the age group 40 to 59 years old. There is almost equal distribution, if you look at the graph, and you see the pink and the blue. There is almost equal distribution between the males and the females, within each of the 7 age groups displayed on the graph. We take note, however, of the 130 COVID-19 cases among children and adolescents, currently accounting for about 4% of our cases.
That was Chief Medical Officer Dr. Mcmillan, who also said at the press conference today that the distribution of deaths nationwide follows population density, with 69% of COVID-19 deaths recorded right here in New Providence.
In all age groups, more males, that's in the blue, are dying from COVID-19 than females. The exception is the 40 to 49 age group, where we see the pink bar much higher than the blue. 11% of our COVID-19 deaths in the second wave have been among persons under the age of 40. Whereas in the first wave, we had no deaths in that age group.
The Chief Medical Officer, as well as the Minister of Health, the Honorable Renwood Wells, emphasized at the press conference this afternoon that the flu season begins this October, and they're encouraging all residents to get their flu shot as we fight the COVID-19 pandemic. Reporting live in the newsroom, I'm Altaviz Munnings. Back to you, Keishla.